If you're among the 25% of Americans with high blood pressure, your first line of defense will usually be hypertension medication.
If you have high blood pressure, your heart has to work harder to pump blood through your body. This can lead to the biggest killer in America, heart disease. Luckily, prescription medication can help treat this common condition. Angiotensin converting enzyme inhibitors, or ACE inhibitors, and angiotensin receptor blockers, or ARB drugs, both affect the hormonal system that regulates blood pressure. The renin-angiotensin system works like this. The kidneys produce an enzyme, renin, which is converted to the hormone angiotensin. Angiotensin controls constriction of the arteries, while active angiotensin causes them to narrow. The inactive form does not. Both ACE inhibitors and ARB drugs stop angiotensin from becoming active so that it cannot narrow the arteries, effectively lowering blood pressure. ACE inhibitors like Vasitec and Zestril are quite valuable, but they have one downside, the common cough that often accompanies these medications. For this reason, some people may find ARB drugs like Avapro and Cozar to be more convenient. Some people with hypertension are treated with a group of medications known as beta blockers, like Tenormin, Inderal, and Toprol. Beta blockers work on the sympathetic nervous system, a part of the body that helps regulate involuntary functions, such as your heartbeat. These medications slow the heart rate and reduce the force of its contractions. While beta blockers are useful for hypertension sufferers who also have angina or have experienced a recent heart attack, the side effects, which can include depression and nightmares, don't make it ideal for everyone. Alpha blockers like Hitrin and Cardura cause the heart's arteries to widen, thereby lowering blood pressure. Alpha blockers may be particularly useful for patients with enlarged prostate glands. But because they can actually increase the risk of heart-related problems, alpha blockers are recommended for use only in conjunction with other drugs. Calcium channel blockers, or CCBs, inhibit the movement of calcium into the muscle cells of the heart and arteries. Because calcium is needed for the heart to contract, these drugs decrease the force of the heart's pumping, thereby lowering blood pressure. CCBs are available in sustained-release and short-acting form. Examples of commonly prescribed CCBs include Calan, Norvasc, and Cardizem. Perhaps the oldest known hypertension medications are diuretics, like hydrodiuril and Lasix. Excess salt in the body leads to excess fluid, which in turn causes increased pressure on the heart, or high blood pressure. Diuretics work in the tiny tubules of the kidneys to remove fluid from the body. No matter what medication or combination of medications your doctor prescribes for you, it's vital to take these drugs exactly the way your physician prescribes them.
Want to learn more? Check out other videos and sources on this site for more information.